and the important thing is it is benefited, or we can avoid the events by giving the therapy or by maintaining the blood pressure. It will clearly benefit from medical therapy. So this is the definition which is given for hypertension. This itself gives the importance of antihypertensive drugs, or the drugs which plays a very important role in maintaining our blood pressure. So what is considered as normal hypertension? So generally we used to say 120/80. What is this 120? 120 is systolic blood pressure and 80 is diastolic blood pressure. That is considered to be normal. In pre-hypertensive conditions, the patients will be having 120 to 140 systolic and 80 to 90 diastolic blood pressure. In the stage 1 hypertension, up to 150 mmHg is considered as systolic blood pressure is considered as stage 1 hypertension, and 100 is considered as 100 mmHg is considered as diastolic blood pressure is considered as stage 1 hypertension. So in severe hypertension, the blood pressure, systolic blood pressure goes beyond 180 mmHg and diastolic goes beyond 110 mmHg. So how to reduce the blood pressure? The first common thing we do is lifestyle management or lifestyle changes for reducing the blood pressure. Reducing the weight and sodium restricted diet, changing to diet plan, fruits, taking fruits, vegetables, like these things, and increasing the physical activity by limiting the alcohol. These are the ways we can reduce the blood pressure. How this control of BP or blood pressure, how it is maintained in our body? So physiologically, the blood pressure is maintained by cardiac output as well as PVR, otherwise called as TPR, total peripheral resistance, otherwise called as peripheral vascular resistance. That means the resistance of the blood vessels as well as cardiac output. These two plays a very important role in maintaining our blood pressure. Renin-angiotensin system plays an important role in peripheral vascular resistance as well as in cardiac output. So renin is responsible for increasing the sympathetic system and production of angiotensin 2, that in other terms increases the peripheral vascular system, and in other way it increases the aldosterone and sodium excretion, produces changes in the sodium excretion, increases the blood volume, and it increases the stroke volume, and it increases the cardiac output. Directly increases the cardiac contractibility as well as cardiac output is increased. So this is the general control of BP occurs. So in the renin-angiotensin system, we have seen that clearly. That means release of renin plays a very important role in maintaining our blood pressure. If there is increase in blood pressure beyond the normal level, what will happen? What are the organs will get damaged? So that lead to stroke and blood vessel damage, atherosclerosis, heart attack, LVF, left ventricular failure, as well as kidney failure. So these are the damages which produces by untreated hypertension. The damage will be in cardiac enlargement, in heart, as well as in the eyes. It produces papilloedema and in renal, impaired renal functions, and cerebrovascular accident. That means stroke. So these are the damages produced by untreated hypertension. So how to reduce the hypertension? So we are telling hypertension, that is blood pressure has to be reduced. So how to reduce that? The blood volume has to be reduced. Reduces the heart rate by reducing the stroke volume. These are the ways to reduce the blood pressure. Again, by dilating the systemic vasculature. That means the resistance of the blood vessel has to be reduced so that vasodilatation occurs. So the final thing is to reduce blood pressure, the blood volume has to be reduced, heart rate has to be reduced, and stroke volume has to be reduced. The drugs which produces all these effects, they are called as antihypertensive drugs. So for example, if you take diuretics, they reduces the blood volume. If you take calcium channel blockers or beta blockers, they reduces the heart rate. If you take alpha blockers, they reduces the stroke volume. And dilates systemic vasculature. If you take ACE inhibitor, it produces changes in the peripheral vascular resistance. And vasodilators, arterial as well as venodilators, vasodilators directly acts on the blood vessel and reduces the total peripheral resistance and produces vasodilatation. So these are the ways to reduce the blood pressure. This is done by